to properly educate the patient on proper form and positioning for bed mobility, as well as dependent bed mobility with two helpers. The first component to bed mobility is being able to assume the hook-lying position. So instruct the patient to lie on their back as she is, have her flex the knees up. This is the hook-lying position. Many of the effective methods for moving in bed first involve assuming the hook-lying position. From the hook-lying position, it is important that the patient know how to properly bridge. So instruct the patient to flex the knees up, add the hook-lying position as she is. Next thing we're going to do is have the patient flex the elbows. Now, you're going to press through the elbows and through the heels to bring the bottom and the hips off of the bed, as so. Good, relax. The first component of bed mobility that we're going to address is scooting up in the bed. The first thing you want to do is have the patient assume the hook-lying position, which she is in. The next thing you want to do is have her flex up her elbows, elevate her shoulders. At the same time that she's going to perform a bridge, you're going to ask her to press through her heels and through her elbows to propel her body upward in the bed. So can you do that for me? Yep. She can do this several times, inching up the bed until she feels comfortable. The next component of bed mobility that we will discuss is how to instruct the patient to move down in the bed. So what you want to do first is instruct the patient to lie in the hook-lying position, so bring your knees up. Now, the next component will be flexing the elbows up, much like in the scooting up in the bed position. This time we're going to press the shoulders down to the bed. At the same time that you'll ask her to perform a bridge, you want her to have her pull herself down with her elbows, as well as simultaneously pulling her heels down to the mat to propel herself down. Can you do that for me? Good. You can have her do this several times until she's in the desired position. The next component that we'll be discussing is rolling. In this case, we'll be rolling to the right side. The first component of rolling is that you need to scoot to the opposite side of the bed so you have room to roll. So in this case, we'll be scooting to the left for a right roll. So what you want to do first is have the patient assume the hook-lying position, so bring your knees up for me. You're going to flex the elbows, elevate the shoulders. We're going to have you bridge. Instead of moving up or down, you're going to move to the left. Good. From here, we can initiate rolling. What you want to do next is lay the right leg flat, take the right arm, stick it out to your side just a little bit. The left arm crosses the body, leaving the left knee and hip flexed. You can use the left foot to propel the body toward the right side, as well as the momentum from the left arm crossing the body. Can you go ahead and do that for me? You had to roll to the right. If you want to roll to the left, use the same type of mechanics that we used, but this time you want to have the patient scoot to the right first, so there's room to roll to the left. And you would lay the left leg flat, keeping the right hip and knee flexed so you can propel the body over. Next component of bed mobility we will be discussing is how to properly handle a patient who is dependent assist with two helpers. The easiest way to do so is with a draw sheet. You can either have the draw sheet positioned under the patient prior to entering the room, or you can have the patient roll and position it under. So we're going to have our patient roll. To do so, first we're going to have her roll to her left. So cross your right arm over. Bring your right foot up. Press through your right foot to roll to your left side. You're going to roll the draw sheet. Make sure the draw sheet is under the patient's hips as well as supporting the shoulders. Push it as far under the patient as you can. Have them roll back on their back. Now roll to their right side, flexing the left knee up, crossing the left arm across the body. The other helper will pull the sheet out, make sure there's no wrinkles. Have the patient return to the lying on the back. Once you have the draw sheet placed under the patient, what you want to do is make sure there's good communication between the two helpers so that when you move the patient, we move in the same direction. From this position, we can move the patient down, up, side to side. In this case, we're moving the patient down first and then returning her up. So what you want to do is have each helper grasp the draw sheet and pull it tight. Ask the patient to cross their arms and nod their head to clear the head from the pillow. What you want to do is give a 3 count, and on the count of 3, we're going to move the patient down. Ready? Yes. 1, 2, 3. With the patient down in the bed, we can now move the patient up toward the head of the bed. Same rules apply. Make sure there's good communication between the 2 helpers. We're going to grasp the draw sheet, pull it tight, make sure the patient crosses her arms and flexes her head to clear the head from the bed. On the count of 3, we're going to move her up. You ready? 1, 2, 3. Another component to bed mobility with dependent assist is rolling. From this position with the draw sheet under the patient, with 2 helpers, you can have the patient roll to the right or to the left. In this case, we're going to have our patient roll to the left. The person on the right is the person who initiates the roll. The person on the left is the person who facilitates and makes sure the patient doesn't roll too far. The first thing you want to do is have the helpers grasp the draw sheet. Have the patient first cross the arms, because the first thing we'll need to do is scoot the patient toward the opposite side from which they were rolling. In this case, as we're rolling to the left, we're going to scoot the patient to the right side. So on the count of 3, we're going to scoot the patient toward me. Ready? 1, 2, 3. Once the patient's in this position, there's plenty of room to roll to the left. Now you want to make sure the patient is positioned properly. So you're going to take the left arm, put it out to the side just a little bit. The right arm is going to be across the body. You can flex the leg, or you don't have to, whichever one is more comfortable for the patient. In this case, we won't. In this case, since we're rolling to the left, the helper on the right will grasp the draw sheet, pull it tight, while the helper on the left stands and protects the patient from rolling too far to the left. The person on the right is going to lift the patient's hips and shoulders up and facilitate her rolling to the left, as so. The activity is complete, and the patient is completely lying on her left side and is comfortable. In this case, we have our patient roll to the left. You can roll to the right. You just do the opposite of what we've done. First, have the patient scoot to the left. In this case, the helper on the left would be the person initiating the roll, and the person on the right would be the facilitator to make sure the patient didn't roll too far. This concludes the major components of bed mobility that you will need in instructing the patient on how to perform it themselves or with dependent assist with 2 helpers. For further questions or concerns, please refer to the Mobility in Context textbook.